was in the 1900s that HIV was first spread to humans from chimpanzees. 1968. AIDS is first reported in the Midwest. 1980s. The United States HIV epidemic begins. 1984. Scientists learn that the cause of AIDS is HIV. 1995. AIDS becomes the leading cause of death in the United States. 1997. Highly active antiretroviral therapy reduces death by 47%. 2012. HIV pre-exposure prophylaxis is approved. And here we are in 2020. There is still no cure or vaccine for HIV despite decades of research. The likelihood of transmitting HIV increases with other sexually transmitted diseases, including gonorrhea, syphilis, and chlamydia. 1 in 7 are unaware of their HIV infection. That's about 14%. The high number of HIV-infected people who don't know they're infected, increased risk of transmission. Pre-exposure prophylaxis, or PrEP, has been around since 2012. When PrEP is used appropriately, it can decrease HIV transmission by 99%. Research has shown that undetectable HIV viral loads makes it nearly impossible to transmit HIV to another person. Current guidelines suggest all people living with HIV begin antiretroviral therapy as soon as possible. Access to continual care is essential for the management of HIV. Individuals who engage in male-to-male sexual contact disproportionately represent people living with HIV in the United States. Of the over 1 million people in the United States as of 2016 living with HIV, nearly 60% are men who have sex with men. Of the nearly 40,000 new diagnoses of HIV each year, approximately 70% of those represent male-to-male sexual contact. Despite the legalization of same-sex marriage in 2015, members of the LGBTQ community continue to face unique challenges that place them at increased risk for poor health outcomes, including HIV transmission. LGBTQ discrimination is still very alive in the United States, and without protected rights, these individuals risk losing their jobs, their health insurance, as well as their homes. In the United States, compared to the general public, members of the LGBTQ community are 2.25 times more likely to be unemployed, have a 25% greater incidence of being uninsured, are 1.8 times more likely to have food insecurity issues, are 1.4 times more likely to have an annual income less than $24,000, and are less likely to have graduated from college or hold a postgraduate degree. Other factors that contribute significantly to high-risk negative outcomes for individuals involved in male-to-male sexual contact include social and political factors. This may include homophobia, stigma, lack of access to quality care, and historically negative interactions with the healthcare system. Because of these factors, getting access to pre-exposure prophylaxis, regular HIV testing, and continual care in order to maintain undetectable HIV levels is disproportionately difficult for male-to-male sexual partners compared to other groups of people. Fortunately, there are services out there to help patients living with HIV. One example of this is the Ryan White HIV/AIDS program. It provides primary medical care, support resources, and medications to low-income people living with HIV. It serves to improve health outcomes and ultimately decrease HIV transmission, specifically within hard-to-reach populations. More than 50% of patients living with HIV receive services through the Ryan White HIV/AIDS program each year. One of the current strategies aimed at HIV prevention is called the High Impact HIV Prevention Project, courtesy of the CDC. Through guidance from the National HIV/AIDS Strategy, the goal of this public health intervention is to maximize the impact of prevention through HIV testing, linkage to care, partner programs, and access to antiretroviral therapy. The High Impact Prevention Project targets the most cost-effective means to decrease overall HIV infection for the largest number of people. Although this strategy allows for HIV testing outside the healthcare system and can potentially identify people with HIV who would not normally see a primary care provider, it lacks the capacity to provide community to those living with HIV as well as mental health services. Another CDC public health intervention is called the Steps to Care Toolkit, which targets a single patient and their healthcare team. The goal is to improve HIV continual care, decrease HIV viral loads, and improve patient self-management of their health. The patient navigation section focuses on working with case management and improves relationships with members of the healthcare team, which ultimately results in care retention. The purpose of HIV self-management section is to empower individuals living with HIV regarding their health and medications. Lastly, the care team coordination section allows for healthcare professionals from different specialties to provide continual care for the patient, resulting in optimal outcomes. This is a closed-loop intervention at the individual patient level, but alone it lacks the ability to identify and diagnose patients living with HIV, especially those who do not seek regular care from the healthcare system. Lastly, research has been done involving the use of mobile phone apps and online chat rooms to form community around those at risk for HIV, as well as those living with HIV. These services provide people with important resources and provides a community for those who may not publicly identify as someone who would be at high risk for contracting HIV. Unfortunately, alone, this intervention also lacks the ability to screen, test, and diagnose individuals. It also lacks the capacity to have physical interaction with a healthcare provider and does not link regular care to each person involved. Each of the three strategies described previously have benefits that I believe would provide the most care and resources if they were combined. This is especially relevant to high-risk individuals, including those engaged in male-to-male sexual contact. Together, through community effort, access to primary care and mental health services, prevention, including PrEP, diagnosis, treatment, and ending the stigma surrounding HIV and male-to-male sexual contact, a solution to the HIV problem can be created. After all of this, I ask two simple things. 1. Continue educating yourself, your family, and your friends about HIV. And 2. Support your fellow Americans by advocating for protections, access to quality care, and ending the stigma.